morning. Hi there. My name is Angie. I'm going to be your nurse today. Can I get your name and date of birth really quick? Diana Prince, correct? Yep, that's what matches on my bracelet. And your date of birth, 8/30/1989. That also matches what I have on my bracelet. Well, Miss Prince, I just wanted to let you know, you just came in for a bowel obstruction and your belly doesn't seem to be working very well. So the physician has ordered for us to insert a nasogastric tube. And this tube will go in through your nose and will set in your stomach, and we will utilize it to decompress your stomach and to keep allow your bowel to rest. Okay, not the most comfortable thing to have done, but hopefully this will be quick. Do you have any questions on that? Okay, so first things first, I do want to gather all of my supplies up here really quick and take a quick listen to you. All right, so I'm going to listen. First, I'm just going to listen to your lungs. I want to make sure I listen to your lungs before and after. Okay, make sure that there are no changes in your lung sounds. I'm also just going to really quickly listen here to your belly and confirm that I have very minimal vowel sounds here. Okay. Another thing I want to do, Miss Prince, is check your nasal passages. Have you ever had any surgery on your nose, any history, trauma to your nose or anything like that? No? Okay. So I'm not seeing any deviation or anything like that. Do you have a preference on which nair? This one close to me, the right is fine with you? Okay, perfect. All right. The other things, you have been able to swallow okay, haven't had any issues. If we had any concerns, I could assess your gag reflex really quickly, but since you've been swallowing well, we're good there. Gloves. I'm going to give you this towel to place over your chest here. Sometimes this can elicit a gag reflex when we do this, so just know that if you do start to feel like you're going to vomit, I will give you this Emerson basin or this basin so you can utilize that as well. And also some tissues and stuff if your eyes start watering or anything like that. I'm going to prepare my tape to secure this really quickly. So I like to create what I call my pair of pants. And I can put that on the side of my table here really quick. So I've got my pants. And I also like to use a small piece to determine the length of my tube. I sometimes like to coil the end of this, especially if the tube is a little cold, it can be a little bit stiff. So giving it a little bit of a curve on the end can sometimes help with that. Alrighty, so first I'm going to measure the length here. So I am going to start tip of your nose here to your earlobe, and then I'm going to go down to the xiphoid process, and then just use my to So I can either, sometimes people like to just dip this in the end of water. I've got a water-based lubricant here. I'm just gonna lubricate the tip. I'm going to give you this cup of water. So first thing, what I'm going to have you do is kind of tilt your head back. And when you tilt your head back, once I get towards the back of your throat, then I'm going to have you lift your chin towards your chest. And I'm just going to have you, if you can, just keep swallowing and taking sips of that water as I insert this tube, okay? So first things first, I'm going to tilt your head back. I'm going to go in. Once I get to the back there. All right, now I'm gonna have you do a chin tuck, swallow, swallow, and I would go on my mannequins here. It's not gonna let me go all the way to my measured tape, but I'm gonna insert all the way to the point in which I've measured. Hold that there. I'm gonna look in the back of your mouth here really quick, make sure I don't see any coiling or anything like that, which I don't. Okay, you're able to talk to me okay. All right, you was able to swallow and everything, perfect. So since I've got it to the point in which I measured, I am gonna go ahead and secure this. So, down the bridge of my nose there. That secured. I am also just going to take and mark right here, try to get on my tube where I've got that inserted to. All right. Let me secure this to your gown with a safety pin. So placement, to confirm our placement here, I will definitely need to get an x-ray. Another thing that we can do here, I'm going to use my piston syringe. I would pull back just a small amount of gastric aspirate here. Does not take very much. Could test this on a gastrical pH, looking at the pH of the gastric acid. I'm also looking at the color. So is it like a green? Does it look like a bile consistency? So again, just thinking about placement, if this is in my stomach, I would be looking for a lower pH because it would be acidic. If it was a clear fluid that had a pH of maybe 6 or higher, I would be very concerned that I could be in the lungs. So I'm looking for that lower pH with my patient here. And so I can say I got a good pH of 3, so I'm happy with that. If I took just a tiny bit out, I wouldn't necessarily have to return that to the patient, so I could then just discard that. All right, so we've got your NG tube in. We can get you comfortable here. So the goal is going to be, we're going to send you down for surgery and hopefully figure out what's going on with that bowel obstruction. But we will have this NG tube in place for a while, okay? Before we can utilize it and hook it up to suction, we do want to send you down for an x-ray confirmation. If my tube was one that had a stylet guide wire, then this would be the point in time after I get x-ray confirmation that I could then remove that stylet and then start utilizing my NG tube as well. So let's get you comfortable. Lower your bed back down here. Now, if we were to do any type of feeding or anything like that, we preferably like to keep your bed at least up 30 degrees, but I can lower you down a little bit if that would make you more comfortable. Alrighty, let me clean up my mess. these tissues here for you. This is your bedside table. Alrighty. All right, Ms. Prince, is there anything at all that you need from me at this time? Okay. All right, so you will be NPO until your surgery, so we do have that tube there. And once we've got that confirmation, we're probably gonna hook you up to suction. So if you have any questions, please do not hesitate to reach out. You've got your call line and reach. So let me know if you need anything. Thank you.